everyone. Welcome to the TMR Whole Nurse Podcast. In this podcast, we talk about everything in nursing, especially those things that people don't talk about. My name is Debbie. I'm a nurse at TMR, and I'm joined by my colleague.
My name is Barbara. I'm also a nurse at TMR, and I'm glad to be part of this conversation.
So today we are going to talk about a topic that is dear to our hearts as nurses. We are going to talk about the heart of nursing. Barbara, what comes to your mind when I say the heart of nursing? What does it mean to you?
Thank you so much, Debbie. To me, the heart of nursing is that passion you have, especially when you're taking care of the patient who has come to you to seek a service and they really need you, they're in need of help. So the passion that you use and the way you handle them, and at the end of the day, you bring smiles to them. That's what I understand by the heart of nursing.
Yes, because sometimes nursing is beyond us giving injections. It's beyond what the textbooks talk about. It's all about the human connection, how you connect with the patient. Because these patients come to us when we don't know them on a personal level.
Yes.
A patient comes, they're actually a stranger to you, but when they come in, we make them feel at home. A nurse will hold your hand, a nurse will get you a wheelchair.
They'll
Nurse,
get you a bottle of water.
yes, they will help you to the bed.
Adjust
Those
it
things,
where it's
yeah.
comfortable.
Ask you where if you're comfortable. That is actually what we call the heart of nursing. It's beyond coming and we give you medicine and you go back home.
Yeah, sure.
So, nursing is beautiful, but some people haven't seen that beautiful side of nursing. And we are here to talk about it because we are proud to be nurses. Why not talk about it?
Of course,
Yes. As a nurse, you actually have to feel proud of the profession because it's a profession. This profession, not everyone can do this. Not everyone can be a nurse. When you find yourself in this profession, just know you're chosen by God to be here. So why I chose to be a nurse was it wasn't a dream as I was growing up. It happened at a point in my life where I was sick. I was critically ill, actually. I had to undergo an emergency surgery. Yes,
Sorry
it
about that.
was back then, some years ago, and that year was one of the difficult years of my life. I thought I was not going to survive, honestly.
Ooh,
Yes.
sorry. So we wouldn't be having a nice baby today.
I wasn't dreaming of being anywhere near medicine. I wasn't dreaming of being in the medical field. But that was like a turning point. When I was hospitalized, the surgery was successful, but my recovery was a bit tough. But the nurses were there for me. The nurses, oh my God, they were there for me. They took care of me. And that made me want that. Like I wanted to do that for other people. That's where I got the passion. That's where I got the that's why I said I'm going to do nursing so that
you can
I
also.
also I can touch someone's life the way those nurses touched mine. And even when I came to the field, I felt
I'm sure it didn't even become so hard for
it.
you to adjust.
Yeah. Right from nursing school, I loved working on patients. Whenever I would go for practice in hospitals, I would just remember how I would put myself in the
That
shoes of a
shows, yeah.
patient and remember how I was. Then I give the same care to the patient, and I can never be mean to a
Because at
patient.
the end of the day, you'd want them to smile like the way you did.
Yes, that
Then,
means God planned it. God planned that I had to be a nurse, and I'm really glad. Tell us why you became a nurse.
so me, I would dive more into midwifery part. I grew up in a family where there are medical people. First of all, my mom is a nurse, so I would see how she would really take care of these mothers who have come to give birth, especially. That way, how she handles them, that way, how she would wash for them, that way, how they would appreciate. So I'm like, she was my inspiration to join this course, actually, to join this field, and I'm like, wow, bringing smiles to people making them feel happy, making them feel like you have really done something so big for them. Like, especially after that time of giving birth and their babies are out and they're happy and they're thanking you, they're saying, God bless you. Those were really a bit touching. Personally, I was still young, but I could see how much they would appreciate really. And it is something that you cannot replace. It is something that you're giving to someone you don't even know whether that's their own child they're going to have. You don't know if it's going to end there and maybe they will not have more kids. But that period when you see them happy, you see them become a family, you see them, it really touched my heart. I'm like, wow, if I can do this, it would satisfy my heart basically.
And you're a good one.
So
your mom must be proud of you.
Yeah.
Like, Barbara is such a good nurse.
So that is
good
why
midwife.
I really chose this path, and I cannot regret even for a single minute why I chose it. I'm so happy and I'm so proud of it.
Mommy has to watch this because she has really inspired you in a good way.
Oh God, yeah.
We are going to look at ways in which nursing is beautiful. The first one is human connection. We get to connect with patients, with people
that we don't know.
Yes, someone comes, they are scared, they're anxious, they're asking questions, a lot of questions. They look confused. But it's not actually confusion, it's because they're scared. And when you sit with them and like hold their hand and talk to them and explain to them, they relax.
They feel like they're in the right place. Actually, they feel like they're with the right people.
And when they relax, that is where you really come to understand that this is what nursing is all about. Sometimes healing starts with being heard. Yes, it starts by someone hearing you, someone giving you attention, and they hear you.
When you pour out to them, it's the way you feel. At least you feel like you've really had a lot that you've been carrying, and at least you've shared it with someone, and it will somehow calm them down.
And this person is understanding you. So that's why we are chosen. Not everyone can.
Not everyone can do that.
Yeah. Nursing is really beautiful. So another way that nursing is beautiful is the way nurses are always there in the big life-changing moments. Like when you're giving birth, the patient is giving birth, and I know you can relate.
You're there.
How does it feel?
That baby come out, baby crying, especially during labor, that time when the baby is almost coming out. There's no one joking there. The mother is not smiling at all. She's in pain. All that she's praying for is the baby to come out. So I'm telling you, when that baby comes out and they hear they cry, all the special expressions disappear, and the mother is able to smile. They're able to
and they can never forget how you made them feel.
Yes.
They can't forget.
So it's something that is really.
That's why if a mother gets the best experience when they're giving birth, they can never forget. Even when they get the worst experience, they can never forget.
Yeah, they'll actually always relate.
So it is always good to give them that best experience so that they feel like they can have
have more.
Yeah, they can have more children. Most people actually, the bad experience they get at the hospital can make them feel like I will never give birth again.
Yeah, sure.
Yeah.
Because they feel like if giving birth feels that way, if I have to go through all that I went through, then I better stop here. But if the experience is really good and they get out of that labor room happy, trust me, even not in a year, you see them coming back. And that's good, because at the end of the day, they expect good results.
Imagine a life without midwives. Shout out to all midwives out there. Oh my God, you're doing a great job. Oh, God bless you. Can you even count? I feel like midwives and the gynecologists and midwives, if you'd count the number of children you've
exactly, that you've helped their mother's birth.
You feel like
you can even make a school.
I know.
You can just start up at school.
That's beautiful. So that is one of the big life-changing moments someone experiences with nurses. Another one is recovery. These difficult recoveries. Let's say a patient is in ICU. Some patients be in ICU for months, but the ICU nurses are always there for this patient. They don't give up. In ICU, there's nothing like sitting down.
Yeah.
You're always on your toes. The families lose hope. and you have to be there for the families,
Yeah, they are always
counseling the
looking at
family.
you. They're always,
Yes, they look at you. They feel like you can actually do a miracle.
yeah.
Wow.
Actually, that is why in the first place we said these people who seem to be strangers become part of family. Because at some point they need you. They need you to be there.
So a patient is in ICU for, let's say, 1 month, and then you watch them go through all that until they recover. That level of patience, like it takes, like nurses, oh my God, ICU nurses again. So apart from birth, another big life-changing moment that nurses come in is during the difficult or long recoveries. Let's say a patient is in ICU. Some patients be in ICU for months, but these nurses don't give up. They don't give up even when the family is actually giving up. You find the nurses being there, holding the family together.
They're talking to them,
Yes.
updating them all the time,
Yes.
so that they don't feel like no one is there for them. Because at some points the patient, already the patient is in ICU. They don't know what's going to happen. They don't know if the patient is recovering. They don't know what's going on. But the nurses keep pushing them. They keep reassuring them. That reassurance means a lot to the family.
A lot. And ICU nurses, in ICU, there's nothing like sitting down. You're
On your
always on your
toes.
toes, and
Yeah.
you don't give up. Then, after months of not giving up, you see this patient recovering. That is something big. And we applaud all ICU nurses. You're doing a great job. May God bless you. So, nurses are also there in the most vulnerable moments and painful moments, like end of life.
Palliative.
You'll be on shift and you lose a patient.
You're literally working on this patient and you're seeing them lose their life. It's very, very, very heartbreaking.
Their life ends, and you see how families break down. That is a lot of emotional.
Stress that you have to
Yeah,
take in.
you can't come on the shift and lose a patient and go back
The
home the
same.
same.
No.
You go back broken. And if you're someone that has a nurse in your life, maybe you have a sister that is a nurse, you have your spouse that is a nurse. If you have a nurse in your life, always check on them. Like sometimes this profession we're in, we forget ourselves in the process of taking care of others. You forget about you, and then you need people to also be there for you.
Because at the end of the day, it's when you go back home, you've left this patient on ward. You want to know how they are. Imagine that's the heart of nursing. You even call. You're like, please, kindly update me on that patient. So literally, you're keeping awake because you want the other patient to get well. And at the end of the day, you will need someone also to appreciate you, to keep pushing you, telling you you're doing good, you're
And-
doing well, you're doing a very good job.
And it's not that every hospital has. We are privileged at TMR to have a psychologist, because we, after these difficult moments of, let's say you've lost a patient in ICU, that is so heavy on you. So we get to interact with a psychologist and let it all out. So I wish all nurses in hospitals can have that.
Yeah, actually, the whole world should really have psychologists,
Yes,
especially in
we
the
need
nurses,
that,
in the nursing
because that
department.
can affect you and you fail to be the other nurse that you've been, because it drains you
You're always
emotionally.
actually thinking about it all the
Yes,
time.
and yet you have to be there for other patients.
You're called to love and serve, so you don't have any escape route. So
That's
you
why
have to.
nursing makes us strong, both emotionally, physically. Like there's this resilience we get
Yeah.
when we come into this. That's why we are chosen. We are chosen by God to be in this field, because what we stand, not everyone can actually stand what we stand.
Yeah, actually, someone will say, being nursing is not for the weak. Because at the end of the day, the things you face, the things you go through, all those hard times, not everyone can take them in. Some people have joined nursing schools and dropped out because there's some things during training they couldn't really take on. But there's some of us who have kept pushing. And it has kept us grow stronger, by the way, because you keep facing it each and every day. But when you have someone to talk to, as you have said, TMR has empowered us and given us a platform where we can have sessions with a psychologist. So at least when you have a session and you talk to someone, you'll come back fresh and you're able to attend to the next patient happily.
Yeah. So another thing, how nursing is beautiful is the way we find ourselves advocating for patients, for our patients. A patient comes in, they're in pain. A patient, let's say they're even unconscious. They can't speak up for themselves, but then we come in and speak for them. You find us pulling ropes with doctors. The doctor is busy, maybe they've forgotten your patient somehow. Like you speak up, you're like, my patient needs this, they need to be reviewed. We speak up for our patients, and that is something you can't find anywhere else. It's only in nursing. And it's nurses, well done. Let's all be proud of what we do.
The small things you really do.
Yes, the small
they
things
make a difference in someone's
the small things
life.
we do for patients. A patient comes and you just
hold their hand.
Turning them in bed, changing their position,
changing for them bed
giving
sheets.
them a bed bath, doing a bed bath.
It means a lot. Giving them a glass of water, helping them, position them in bed, talking to them, continuously reassuring them. It keeps them happy, and the recovery process is always smooth for them.
So I'm going to talk about a story that I can never forget, because I'm sure that patient up to now, they can also never forget. I remember it was this day I was on shift. I was ending shift, actually. My shift was ending. Actually, I was leaving late because we were busy. The day shift was busy that day. And then I was leaving, packed my bag, my water bottle, I'm leaving. The moment I was leaving like this, there was a patient coming in, an emergency. Car parked there. Their daughter had gotten a very bad accident. The mother was crying, my daughter is dying, I need help. Remember, I'm tired. That's what nurses experience. Yes, my shift has ended. My God, I'm finally going home to rest.
After having a very long day.
Remember, my colleagues are busy that have come for night shift. I forgot that I was tired, threw my bag down, called for help. They had to get the surgeon on call immediately. We rushed to theater. This patient was worked on. I remained in theater, I left when we had transferred the patient to ICU. So I left the hospital like at midnight.
Wow.
I was physically exhausted, but my heart was full.
That's the true definition of having the heart for nursing.
The heart of nursing. That's where it comes in. Sometimes even when it's hard, we push.
Yeah, you keep pushing. You forget. You remember. You forgot that you're even drained. You forgot that you had a very long day. You forgot all those things. But you had to keep pushing. That's good.
Tell us.
Okay, thank you so much, lady. So for me, there's this day I was still even under training. I was in the nursing school, so you know how nursing schools can be. They post you for training, different hospitals. So I was in one hospital, which I won't mention. I was on a night shift, so this man comes in running like so crazily. I need help. So I was writing something. I was filling someone's form. So I came. I forgot. I just put everything down and I had to run. Reaching Dhaka, they had a patient who could not even. The patient was really very, very weak. So they handed me over some documents, checking on their papers. They had done some investigations from where they were, and this patient didn't have enough blood. He had actually lost a lot of blood. So they're like, please, nurse, save us. Like you are the only hope.
Yes.
You are in front and they expect you to bring back that life that is really ending. So I had to run to the lab. The patient didn't have enough blood, what we call low. Hemoglobin level was very low. So I had to run to the lab, reaching the lab, they told me the only blood left was already booked by a patient who was also very ill. So I had to plead. I told them, please, at least if I can have at least packed cells or small amount of blood, so that at least this patient can have a life. So I was lucky enough. I was given blood, took it, we transfused the patient, and the next morning they were not the way they came. It really brought a very big difference. So I was so happy that I brought back life, and they were discharged happy. At least the patient was able to walk, they would eat, they had gained some energy. So after some time they call me. I wasn't even remembering because I didn't take their number. So they call me and they're like, this is so and so, the father to the child that you saved. I was so happy, I couldn't believe. I didn't even know that they had gone back healthy. But those small actions that you do, acting quickly, the fact that I was so quick to go to the lab, get blood, transfuse this patient, it meant a lot. And up to today, surprisingly, they call me at least in a year. They're like, hello, are you okay? Are you okay? We pray for you every day.
They don't
So
forget.
those things, those small words.
Because I also remember that patient, they were in ICU for like a week. But then I kept like going there to check on them to see how they're progressing and all that. After 1 week, they were discharged, and the mother came and prayed for me. Like, she touched my head and like prayed. I remember getting emotional and I cried.
Yeah.
And
you may not see what you've done, but the patients and the caretakers always see the impact you did for them. And I'm so glad, I'm so happy. At least you have someone who you're sure that they're praying for you every day.
That's beautiful. So now we're also going to look at challenges that come with nursing. We've talked about the beauty of it, but the beauty comes with challenges.
Yeah, sure.
There's so many challenges in nursing that takes being strong, takes you being actually chosen to keep going in that profession. First of all, the long hours that we work long. There's no way you can avoid working long hours in this profession.
Yeah.
You can't say that your shift has ended, that you just leave a patient.
Now imagine if you had left that
Yes.
patient.
Imagine if they had come. I have an image that I just go hold my bag and like go. You can't do that.
You can't have a heart.
You can't.
If you really chose this with passion, you can't really see a patient crying out and you're like, my shift is done.
You can't do that.
And that keeps you, that makes you
also
work
we have
long hours.
the challenge of having that emotional pressure. A patient is critically ill, you be on pressure, like, will they survive that tension that you be on, because you feel like you're responsible for their life.
And you imagine you carry it home and you bring it back the next day because you're home, but you're thinking, I've left someone very ill. I am going back to find them. How are they going to be? So that stress, that emotional pressure.
And we are humans. We are humans too. We are humans that we also
feel.
Yeah, we feel.
We feel for this patient.
We feel and we get tired, but we don't stop. The resilience, nursing teaches us resilience. We end up taking this resilience even outside. You're home, you face challenges, but
you keep pushing. You don't give up.
And that's why we also need help. We should accept that we need help sometimes. If it's overwhelming, ask for it. If you feel you need rest, because you can't function, you can't pour from an empty cup.
Yeah. And at some points, that's why even when we ask for leave, the good thing is that TMR has given us a platform where you can at least take a leave and you rest.
It's very important.
Because you need to refresh your brain. You need to at least have some time off so that you can come back when you're fresh. It helps you keep pushing. It at least somehow, that drainage that you have during your workplace, during your working hours, somehow you have to rest and reflect on all those moments and come back when you're fresh.
So as we come to the end of this conversation, we would like people out there to know that nursing is beyond the profession. It's beyond putting on scrubs and you show up at work. It extends deep to how we make our patients feel. And that connection, that compassion. Nursing is all about the compassion and the care that we give to our patients. And that is the heart of nursing.
So, as Debbie has said that we are concluding this session, we still come up and say nursing is beyond giving medicine. Nursing is beyond putting cannula on a patient. It's beyond a lot of things. But giving people the care and the hope when they need it. At that point, it really defines what nursing is. Being there for someone, the small things you do for them when they come and they really need it, it really defines what having a heart for nursing is. Yeah,
And just imagine a world without nurses, without nursing.
How would that be? It would literally be empty.
Yeah, the hospital can't actually operate without nursing.
No.
We are the backbone.
We are the backbone of medicine,
Yes.
of this nursing profession.
Yes.
Because the story of Nightingale, how she used to move with the lamp and making sure she checks on every patient that they had. She was a nurse. She was neither a doctor or a surgeon. But having the heart for nursing kept her do what she was really doing. And that defines who we are really.
Sometimes it's about how we feel when we finish, when at the end of a shift, when you know that you worked on a patient and the patient said thank you.
Yeah.
And the patient went back
Happy.
Okay, even if they don't say thank you. Even if
But you know you have
Yes.
changed the way they came
There's
feeling.
that satisfaction you go back home with. And that alone is enough. Yes, and that is what keeps us showing up every day.
Every day, yeah.
Even after facing a difficult, heavy shift, you still wake up in the morning and
Yeah.
show up.
Your body is drained.
And
you
showing
feel-
up, that showing up when you feel like giving up. Oh my God, that alone should be applauded. Like, nurses, you're doing a great job. And
You're doing
to
really well.
nurses out there, we see you, us the fellow nurses, because we understand.
Yeah. We understand what you're going
Yes.
through, what actually you go through every day, because
Yes.
it's the same thing we too go through every day.
Yes.
And we appreciate you. Never give up, never lose hope, never feel like you're doing what you're doing is not valued. Never
Yes.
feel like what you're doing is just a wastage of time, even when sometimes you face difficulties, because you might also interact with different and hard patients, but never give up.
And some people say most nurses look young. Like, even when, like, you're all, like, you've been in the profession for long, and even when you're in your 40s, you still look young. Like, and it's because God protects us so that we keep there helping patients.
Yeah.
So, thank you, nurses. This is our TMR the Whole Nurse Podcast. We are going to come back next time with another topic, and we can't wait to keep bringing in different nurses that are going to be sharing their own experiences. And we want to be talking about these things because some nurses might think that they are going through it alone.
Yeah,
So we want to talk about it and create a family, of nurses.
We want all nurses to feel like what they're doing is really appreciated
Yeah, it's
there.
appreciated out there.
And by the way, God sees and watches whatever you do.
Yes. So thank you so much. Catch you on our next episode.